Well, hello. Just got in my car. Gonna go to, oh crap. I have to go to Hobby Lobby to return something that I bought for the nursery that I'm not gonna use. And I forgot it inside. I have to go get that. Then I'm probably gonna stop at Target to pick up a couple things for my hospital bag. Just some items that I don't have that I kind of need so that I'm not like trying to, I'll show you when we get there. Forgot to put out the garbage too. Man, now I'm out of breath. Okay, let's go. I just got to Hobby Lobby. I'm gonna run in and return this. I bought like a faux fur rug for the baby's room, but it doesn't quite fit the look of the whole room, so I'm returning it. So at Target before, I picked up a couple, well, 2 pairs of jean shorts because it's getting warmer out. This necklace is such a mess. Oh my god. It's getting warmer out now, and I literally just live in leggings. I don't have any shorts that fit me right now. So I wanted to pick up at least 1 or 2 pairs of maternity shorts. You know, they have the elastic band here. But these are supposedly a size 2, and they're flipping huge. And so not flattering. So these have to go back for sure. I couldn't try them on at the store, so I have to pick out what size I think might fit me and then bring them home, try them on, or try them on in the car in the parking lot, and then just return them if they don't fit. So these definitely have to go back. I'm gonna try on the other pair right now. Okay, I think I'm gonna keep these ones. They are pretty soft. They feel nice. They fit in the waist good. The only issue I have with them is that they're like an inch. I guess they don't look that bad. Let me cover up my belly. I guess they don't look that bad from the front, but in the back, I don't know how good you can see with this over my shoulder, but they're like an inch too long in the back from what I'm used to wearing. I know like I'm gonna be a mom now, but doesn't mean you have to wear super long jean shorts. It's been a couple days since my 35-week OB appointment. So typically between 35 and 37 weeks, doctors will do a swab for the group B strep bacteria. I actually turned 35 weeks the day of the appointment. So my doctor went ahead and that's what we did. For anyone who doesn't know, the group B strep swab is a swab that they do inside the V, down to the B, and they test to see if you have the group B strep bacteria. Now this is totally normal to have. Some women have it, some don't. I'm sure you've heard of strep throat. You know, when you get a sore throat, you have strep throat. That is caused by the group A bacteria, I'm pretty sure. Group A, streptococcus or whatever it is. This is group B, streptococcus, whatever. We'll just call it strep. But doctors like to test to see if you have it because over the years, they've been noticing that babies born vaginally have been going to the NICU for a fever, and it's been associated, that fever has been associated with babies coming in contact with this group B strep bacteria. So in order to cut down on the number of babies that end up getting a fever and going to the NICU, it's become routine to test for this bacteria so that they could just treat it, you know, give you an antibiotic before delivery. And then that should cut down on the cases and all is good in the world. So that's what I got done at this appointment. When I got into the room, the nurse said that my doctor had a medical student shadowing her, and his name was Marco, a man. And she asked if it would be okay if he, you know, came in for my appointment. And of course, the day that I'm like, you know, not just getting my belly felt, when I'm nude and getting swabbed down there, that's when there's gonna be this male shadowing her. But I said it's totally fine, because going through fertility treatment, I've had so many different doctors and nurses all up in my business that I'm not even fazed by it anymore. So I said it's fine, he can come on in. He ended up not coming in because they were running a little bit behind, so he was in with a different patient, and I just saw my doctor for the appointment. But all was good. Like my usual appointments, they did the Doppler. Baby's heart rate was 139, which is good. So my last appointment, I don't know if I even did an update on this or not, but my last appointment, her heart rate was the lowest that it had been this entire pregnancy. It was like 129, and usually it's in like the low 140s. So that was kind of concerning to me. My doctor said, don't worry at all about that. It's totally fine. It ranges between 110 and 160, but at this appointment, her heart rate was 139. So that was much more closer to the normal that I'm used to for her. But at the beginning of the appointment, the nurse asked me if there was any concerns that I had that I wanted to talk to my doctor about. And I told her yes, because when I was showering the Sunday prior to my appointment, I felt a lump in my right boob. I was just washing myself and felt it. And it's right on the side, like right here. It's pretty big, and it just kind of came out of nowhere. You know, I wasn't doing anything different in terms of showering. I was just showering like I normally do every single day. And I don't know, that day I just felt it. So I told my doctor about it, and she felt me too. Now, let me back up for a second, because 11 years ago, I had 2 lumps removed from my left boob, breast, whatever you want to call it. The one especially was quite large. Actually, I think I still have the images. Let me see if I could find that, and I'll show it to you. So here's one of the lumps that they measured. I'm not sure if I'm reading this right, but down in the left corner there, it says 34.8 millimeters. That's large. This is the other one, and it looks to be 22 millimeters in length, 12 in the other direction. I have the notes on the imaging right here. So it says, at the 3 o'clock position, there's a solid 3.5 by 1.5 by 3.3 centimeter mass with internal blood flow. And then at the 6 o'clock position, there is a lobulated 3.1 times 1.2 by 2.2 centimeter solid mass with internal blood flow. Biopsy is recommended. The findings may represent fibroadenomas. And in case you don't know how big centimeters is, here's a little visual for you. There's 3 centimeters, here's 2 centimeters. Here's the tip of my finger for comparison. Like I said, this was several years ago, 11 years ago. And first I got them biopsied. The biopsy came back inconclusive. So it could be this kind of lump or this kind of lump. And one's totally fine, one's not so good. So what they ended up doing was excising them or removing them so that they could get a further look into what they actually are. And it turns out that they were totally benign, and it's called a fibroadenoma. But they're gone, and I haven't had any since. That's what this lump feels like to me. It's smooth. When you touch around it, it kind of moves away from your fingers. And it's got a smooth appearance. Did I just say that? It's got a smooth appearance. It doesn't hurt. It's just there. So my doctor, she felt it too. And She said that it's possible that it's a clogged duct, like milk duct, but it's not likely, given that most people, their milk doesn't come in until days after birth, and I'm 5 weeks from giving birth, that it's not likely that that's what it is. She said it does feel more like the fibroadenoma that I had mentioned, but right now there's really nothing we can do about it. So she noted it, and then in terms of care or treatment or what, right now it all depends on my nursing status once I give birth. So it really depends on if I'm breastfeeding full-time or exclusively, or if I'm breast and bottle or just bottle. You know, those factors will determine how we move forward with like imaging or a biopsy, or, you know, the next steps in terms of really figuring out what the lump is. So luckily that's not too far away. It's, you know, a few weeks, but I mean, I don't have a plan on whether or not I want to exclusively breastfeed or bottle feed or what. I just want my baby to get fed, and however she's gonna get fed is fine with me. I'm not gonna be disappointed either way. I would like to breastfeed, but if I have to bottle feed breast milk, I mean, that's essentially the same thing in my mind. I don't see one thing as a negative over the other. But anyway, I think that's all I really need to tell you about for that appointment. My doctor said now's a good time to get my hospital bag packed. So that is something that it's actually something I've been trying to get done for 2 weeks now, but I have too many things going on right now. I need to just sit down and do one at a time and just knock them out. I'm rambling. Now I will be going in for weekly checks. So I have my next appointment next week at 36 weeks, and yeah, be starting the cervix checks and wait for baby to get closer to coming. Let me show you a little belly shot of my 35.5 week belly now. There she is with my shirt on. Oh, don't mind the Slim Jim that's on the bed. I just stopped to get a snack. I don't know if I should pull my pants down a little bit or not. Ooh, too far. So she is measuring, I mean, my belly is measuring like 37.5 inches around. I think I'm going through another growth spurt because my stomach has been like rock hard and just really tight, and it usually feels that way when it starts to grow. So I think I might be going through one last little growth spurt here, but there she is. I've been hovering at the same weight for like the last 3 weeks now. Usually it's like every week I was gaining a pound, but the last 3 weeks I've been pretty consistent with the same weight. So right now I'm up about 27 pounds total, which all things considering is really not that bad at all. So I'm expecting to gain a couple more by the end. You know, we still have 5 weeks to go, so we'll see, but I'm not really that concerned anymore. I know I need to like get my butt back in shape once this baby is out. And I look forward to that because I miss being strong.